Who didn't get enough food? Was that an amazing spread or what? So if you haven't heard of Crumb's Bakery, you probably should. Now you know all about it. That's the kind of food they make, and they did a fantastic job. So I just want to say thanks to Crumb's.
Crumb's Bakery?
Yep.
Oh, okay.
Just down the road. Best food in town, in my opinion, but okay. And I'm not getting paid to say that. Okay, so just a couple quick reminders before we go to our next keynote speaker. You've all seen this in your packages. Probably can't see it from the back. This is the Fentanyl Crisis Conference Evaluation. I mentioned this earlier. If you haven't written anything in it, maybe consider start writing some notes. But please try to remember to have these to us by the end of the day. I'll probably remind you once more. Also, for anyone who's interested in getting trained in naloxone, that's the antidote in case someone has overdosed from an opiate. There's going to be some training available for free on April 17th. There's going to be a training at 2 p.m. There's going to be one at 6 p.m. And Freedom Quest will be putting this on. Their address, and they've got a table outside, is 349 Columbia Ave. There's about 15 seats available, and you will leave that training with your own naloxone kit. So I think it's, if you haven't done that training yet, I would jump on that before the seats fill up.
Can you repeat the date, please?
Yes, it's April 17th at 2 o'clock and at 6 o'clock. And Freedom Quest is putting that on, and the address is 349 Columbia Ave.
Please pre-register out in the foyer.
And please re-register out in the foyer at the table. Okay. I think that's it for... Just gotta find my notes here. Okay, next we're going to have a presentation by Leslie McBain of Mums Stop the Harm. Leslie lost her only child, her son Jordan, at age 25 to prescription drug overdose. Since that time, she has advocated for drug policy reform to protect people who use drugs, for harm reduction measures, for education of medical professionals and kids in schools. She works with the BC Centre on Substance Use as Family Engagement Lead. She is the co-founder of the national advocacy and support group Mums Stop the Harm, which is listened to and acknowledged by the federal, provincial, and municipal governments. She has attended the UN Commission on Narcotics Drugs in Vienna. This was in March, and she did this as a family representative. She believes that the failed war on drugs is a war on people who use drugs. She believes that families are the most valuable tool in the toolbox for informing legislators on teaching addictions and preventing death. So at this time I would like to invite Leslie up.
Okay, I'm going to try to do this. Can everyone hear me, or should I use the mic? Use the mic. Okay. I'm a little wild with it, so it goes over here. Thank you for that, Sarge. I'm standing here in front of you, largely because my son died. That was the beginning of this journey. He was addicted to he was at risk for substance use before this, but our family doctor prescribed to him oxycodone for a back injury. And over a 7 or 8 month period gave him more and more and more. Even after I asked the doctor, who was also my doctor, to not do that because Jordan was at risk. It's a long story, Actually, that's why I'm showing you this video. A few months, it's actually some months after Jordan died, Health Canada got a hold of us, my husband and I, and asked if they could do a video as a public service type video. We said sure. And so I'd like to show it to you. That tells the story, and then after that we'll talk more. Thanks. We're going low tech here, so I don't know how the sound will be.
Jordan was irrepressible. He was high energy.
But he was a great kid. He was full of life. He was a real handful.
He walked on his 8-month birthday, and he never stopped. He was born with an adventurous spirit.
Big baseball player, skateboarding. He's really active. Kind of a typical kid.
For the last 5 years of his life, I worried every single moment of every single day. Somehow, I just knew my goal was to keep him alive.
Jordan was in his early 20s. He was working in construction. He hurt his back lifting some wood. The doctor prescribed him an opiate. That opiate became his focus in life.
Once a person is addicted to a drug, it is the main thing on that person's mind. Finding it, paying for it, taking it, and then finding some more. It consumes your life.
It was so gradual, but yet it was just getting crazier and crazier, just his lifestyle. And he'd do a job. He was working as a chimney sweep, and he'd get a check for like $6,000. Gone.
He was not trustworthy. He was unable to focus. Jordan was so addicted that he wasn't getting enough from the doctor, so he was seeking it elsewhere, and he was seeking it on the street. He had stomach problems. He had sleeplessness. It was very hard on his body. He came to us and said, I need to detox. I need help here. I can't handle this. I can't manage it anymore. We got him into a detox program. He was good for a little while after that, and then the call of the drug, he couldn't resist it. He got back into it. In the end, what happened was Jordan took several drugs, 3 of which were prescribed to him, and the combination killed him.
Jordan was probably responsible for the best day of my life. The day he was born and the day he died. The worst day.
Of course, when he died, our lives were just shattered. I'm still trying to figure out how to live my life not being a mom.
When I had a son, a tremendous amount of energy was put into his life, and now it just disappeared in an instant.
We won't have grandchildren, and we won't have him around in our old age.
We are really ignorant of just how devastating these drugs can be and how addictive they are, especially the opiate-based drugs.
I don't think kids in particular understand what they're getting into. They need to know that this can ruin their lives, and in fact can kill them. Parents need to be vigilant and not rationalize behavior changes. They need to be compassionate. If one is angry and judgmental, nothing will push a kid away faster.
Don't ignore the situation. Don't pretend like it's going to go away.
It can happen to anyone. Sharing his story helps me heal. If it saves one kid, it's worth it. He was a normal, everyday, healthy young man. He was working, he was vibrant, he was a loving person.
Every day I think about him. Just remember him. Focus on the good things, the good memories.
He was just starting his life. drugs, he would have been fine. He would have been a successful, amazing guy.
Get the facts and talk with your kids about prescription drug abuse. Visit canada.ca/drug prevention. A message from the Government of Canada.
Now we can watch Michael Jordan. Thanks, Alex. That was about 2.5 years ago or so. Like I say, my son died in 2014, so that's 4 years ago. I know way more now than I did then. I did know some things, and one of the primary and most important things that I knew then, and it's completely borne out in everything I see and know, is that we need to keep them close. No matter what they do, no matter how irritating they are, or how scary they are, or how mischievous they are, or if they steal from us, or it doesn't matter, we have to keep them close. We know that tough love does not work. Anyway, I have a lot to say here, and I just before lunch I was in the coin circle, and I felt like coming up here and saying, just go have circles. Just go have circles, it will all be fine. Because the commonality in that circle was that love is the most important thing. And I say to the people here who are struggling with addiction, or who are in addiction and who want to leave that place, it takes courage, and it takes strength, and it takes connection, and you have to seek it, and you have to hold it close to you as well. And I just can't wish you enough good wishes in that struggle. About a few months after my son passed away, I became acquainted with 2 other moms who had lost their sons to drug harms. And the 3 of us together formed Moms Stop the Harm, which is an NGO, a nonprofit organization that has grown from about 3 of us to about 500 families across Canada now. And all of these families have found us online. We have a website, Facebook. It's just word of mouth, and media. Media has been very big. And basically, it's probably about 75% or 80% families who have lost a child or a loved one, and the others are people who are either frontline workers and workers like yourselves who just want that connection. And then we have families who have loved ones struggling in active addiction now. We started out as a drug policy advocacy. That was our thing. We were going to talk to all of our MPs and our MLAs and go as far up in the government as we could, talking about that we need drug policy reform. We need to save the lives of drug users. And so we did that, and we actually went to the UN in New York in 2016 to UNGAS, which is United Nations General Assembly Special Session on Narcotics Drugs. We went to learn. Nobody funded us, it was out of our own pocket. We went to find out what the hell is going on in this world, that this is happening. It was an amazing experience. Actually, I guess I should say, so just a month ago, I was invited by the Canadian government to be a representative, a family representative on the delegation to the UN in Vienna called Commission on Narcotics Drugs. Happens every year. About 53 countries are supposed to go there. The Philippines weren't there, interestingly, but some other baddie countries were there, and it was pretty interesting dialogue. And I'll tell you a little bit more about that later. So what we in Moms Stop the Harm ended up doing was bringing awareness to Sarge said, all levels of government, because people listen to moms. We realized that. We went from being, most of us, just sort of normal, everyday, middle-class moms to being mother bears, where there was nothing more that could scare us. We were fearless. We are fearless. We'll go talk to anybody, anytime, in the grocery store lineup, at the corner light. We go for it, because we don't want this to happen to anyone else. And of course, it continues to happen, and we continue to work on this. So during my journey, I met Dr. Evan Wood, who is the director of the BCCSU in Vancouver, the BC Centre on Substance Use. And he invited me to, well, actually he employed me. I was like 69 years old at the time, last year. And I said, who offers a 69-year-old a job? You know, this is amazing. I hadn't had a job, or like a real job, for a long time. So I said yes. And so now I'm family engagement lead at the BCCSU. All that means, I don't really lead anything, but the BCCSU is a think tank full of amazing people like Zach, who are researchers, clinicians, teachers, doctors, and now there's the family engagement pod. We have peers pod, people who are with lived experience and who are in either active addiction or in recovery, and the recovery community. So there's 3 of us, pods of folks who bring that knowledge to all of us, to families and to workers and to government. Government is listening to the BCCSU now on the opioid, what's it called, the guidelines, the opiate prescribing guidelines is one that has just come out. Also, the one on your table that has the pictures of the kids on the front, well, you've got it there. I don't think I have the whole thing. Anyway, that's a collage of a fraction of the kids that are involved, who have died. All those kids have passed away from drug harms. They're the sons and daughters of the moms in Moms Stop the Harm. Anyway, the BCCSU, we have just landed this family priorities document, and I hope you will all take a copy. And this is what's involved in this document is what we as families are asking of government. We are asking for a solid, wide-ranging project on anti-stigma. And however they want to do that messaging, well, they are consulting us somewhat on that messaging. But going out on social media, on TV, I think they have posters in bars and various places. Wider, broader anti-stigma messaging that, you know, takes in all stigma. It's a big ask, but you got to start somewhere. The other thing we're asking is for the government to please strictly regulate recovery centers. There's quite a few, I would say maybe 8 or 9 families in our group of Moms Stop the Harm whose kids have died in recovery, in the recovery centers. So there needs to be some surveillance, some regulation around recovery centers. And although we're not asking for this, I ask for this all the time. We need low barrier, low to zero cost recovery centers everywhere. And those centers have to be evidence-based. They can't always be abstinence-based. They must use the evidence of IOAT and all medically assisted treatment, counseling, continuum of care, recovery. And that's really important. The other thing we're asking for is broader and better and evidence-based education in schools from a young age. Well, I hope if anyone here is from the Ministry of Education, I apologize in advance, but trying to get through and get into the Ministry of Education, it's like they have a great big moat around them, and to get in there and to ask for anything that isn't already in their wheelhouse, you might as well forget it. But the government is working on it, the province is working on this, and I really hope to see some change. Kids don't get the evidence-based word. They either get something like the DARE program where, you know, don't do drugs because if you do you'll die, or you'll go to jail, or whatever, you know, things that are, we need to treat them like they're smart because they are. We have to give them the evidence, we have to tell them the real story, and we have to tell them what they can do about their feelings, about their friends who may be in trouble with drugs. We have to give them naloxone kits. We have to make naloxone be a cool thing for them to be ambassadors and warriors out there in their communities. So I sort of kind of went wild there, but we're really asking for a lot more real education in high schools, in schools in general. We also ask for a creation of a really well-managed online resource for families who are looking for help. So, you know, like Judy Darcy has been saying, although I understand she's not saying it anymore, but ask for help once, get help fast, something like that. So what we'd like to see is, if you were a mom or a family member with somebody in trouble with addiction, you could Google, you know, BC, Kootenai, pathways for help. I don't know, anything that kind of goes in that direction, and boom, it would pop up. And you would have actual resources that are in place, that have an open door, that have the capacity. I mean, this would, you know, this would go a long way to solving the problems. It's not going to happen today or tomorrow, but it might happen next year, and it might happen 2 years from now. But I have some hope that the government, the new Ministry of Mental Health and Addictions, is going in the right direction with that. And this portal would be updated on a regular basis. It doesn't take that much. I mean, it's not, you know, neurosurgery. It's an online presence with facts and help. The last thing that we had asked for in these priorities is decriminalization of people who use and possess drugs. And that is one of the most important things. As my buddy Jordan Westfeld says, what is more stigmatizing than being arrested and going to jail for taking the medicine that you need? I mean, it is, everybody here, I know I'm preaching to the choir, but decriminalization is absolutely critical to not solving this total problem, but getting close. I think it was last year in January, I got to meet with, there's about 18 of us, we met with Justin Trudeau in Vancouver at a round table. And every single one of us said the same thing. You know, blah, 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 whatever our story was, whoever we were, and we need to decriminalize drugs. And it got around, and I like Justin Trudeau. I mean, he's not the worst guy in town, right? But we got around to him when we finally had listened to all our story. He actually had a few tears in his eyes. He was listening. He was, you know, he's getting it. And his response was, "Do you know how much trouble I'm having legalizing cannabis?" And we all just sat there. We were stunned. We were like, "Really? Is this is your response to the opioid emergency, the overdose crisis?" So I think we have come some way, but not very, very far. At that time, we had Jane Philpott as Federal Minister of Health. She was awesome. She gets it. She tried. I actually had 2 face-to-face meetings with her, and one in which she said, "You know, if I were to legalize or decriminalize or legalize drugs, I would lose my job." So I thought, you know, well, but anyway, she's great, and I'm glad she's moved over into the Indigenous file, but she'll be really great there as well. So that sort of tells you what I do, what my work is, and I am not alone. There are hundreds and hundreds of people, if not thousands of people in this country fighting for the same thing. And I think everybody in this room belongs in that group, on that team. We can all be warriors for what we know is going to work. We can. We know that decriminalization is the answer to stigma and to saving lives and to saving money. We know some of the stuff that Zach was saying about you know, the possibility of prescription heroin and seeing it roll out slowly in Vancouver to save people from toxic drug supply. We know this will work. Judy Darcy is rolling out gotta think of the acronym and what it means, Overdose Emergency Response, what's the C? Center, yeah, Center, thank you. And with those, the community action teams, everything that she's said and she's consulting on will help. So it's just going to take this huge concerted effort for everybody to keep pushing it, push your MPs, your MLAs, your everybody who could make a change in policy. So anyway, I'm going to step off my soapbox now, but I did want to also talk to you specifically the healthcare providers. And I know that my colleagues, Anne and Alexis, have talked about stigma. Stigma, to me, is the biggest barrier to health, to equitable health care that there is. And until we start looking at ourselves and what our stigmas are, until we start talking about it, we start reducing it by just rational thinking, we're not going to get very far. I wanted to also tell you about this area of stigma. Going to the UN, the Commission on Narcotic Drugs, I was pretty proud to be not only in that group, but you know, and I'm not a flag waver, but I was proud to be a Canadian in this milieu, because here was Canada's resolution to that UN body. It was entitled "Removing Stigma as a Barrier to the Availability of Health, Care, and Social Services for People Who Use Drugs." Resolution L11. It is, and it was pretty radical for that body, which usually talks about modalities and about scheduling and about import and, you know, other more technical aspects. That resolution was argued and negotiated for the whole 5 days. You know, others passed quickly, were adopted quickly, but this one had to come up for negotiation. And I have to say that Russia, the Russian delegate said, "What do you mean by stigma? We don't have stigma in our country." And he honestly said this, okay? He said, "What do you mean by stigma? Isn't stigma something where you elevate someone to a higher level?" He was thinking of stigmata, honestly. And so it had to be explained to him. So anyway, he went on that vein, and every day he had some pushback to the Canadian negotiator. China said, "We don't even have the word stigma in our language." Well, okay. Egypt said the same. And then when they couldn't get those, when those weren't resonating, they started working on the words, the individual words. Well, we don't want to say people who use drugs. We want to say, well, we want to say addicts. Then we want to say drug abusers. And then finally they were going, we wanted people who use drugs. So there was all this, as in negotiations, you know, went to the 11th hour on the Friday night. Finally, it was passed, it was adopted as a resolution. It's on the table in the UN. So it was a huge celebration on that front, yes. So stigma is on the table here. In Canada, we are aware of it, we're working on it, we're talking about it. You need to talk to everybody. You know, I like to say to people, because I said it to myself, what comes into your mind when you say the word junkie? You know, what comes into your mind? Okay, I have a picture in my mind. And it's not a real picture. It's a picture of some idealized, or however you want to say that, individual. It's not a human being. So I can't even read that word hardly anymore, and we should all get there. We should call people who use drugs, people who use drugs. I know a lot of people who are addicted call themselves addicts. It's their right, but I'm not going to use that word anymore. So we have to look at our language, we have to look at the language of others, we have to have the courage sometimes to correct somebody. That's a hard one. I've done it a few times. It's always sketchy. People don't take to it very well. Okay, and the other thing I want to talk about was how you receive families, and this is about family engagement. So in your practice, in your offices and where you see people. Traditionally, I think families have been seen as a nuisance, you know, as a car ride, you know, a ride to the office at best. Sometimes families can act irrationally, can be emotional, can be angry, can be demanding. It's all true. I mean, if your kid's at risk and you're worried about your kid dying, or you're worrying about your kid going to jail, or whatever it is you're worrying about, you're not going to be really the most pleasant, respectful person, probably. So you're faced with this. I know that. I ask that you be able to step back from that sometimes. It's hard on you, I know. Your self-care is critical to your lives and to your welfare. But if you can step back and treat every single person who you encounter that is dealing with addiction with respect, first of all, respect. Oh yeah, so that reminds me.